Hi, I'm Duncan Weatherston, one of the founders and the CEO of Smile Digital Health. Today's session is talking about reimagining prior authorization, specifically thinking about how AI and FHIR can be used to transform your experience. There's a significant burden associated with prior authorization. It's been a challenge for both providers and payers for a very long time. The main issue is that it's a highly administrative task. It's got a requirement for deep specialization and the analysis of rules to render decisions about the treatment and the payment of care. This has been an issue both from a functional perspective and a perception perspective, and we've seen some evidence of this in the news recently. However, with the advent of AI, clinical quality language, and rules processing, in conjunction with high quality information, we're in a position to reinvent prior authorization, to be able to use automation to make it much more effective and current tools to make it very accurate. So from a payer perspective, manual reviews drive substantially long periods of time and effort associated with each prior authorization review. And some of the tooling we've had is less accurate and has driven additional challenges in the process. It's led to dissatisfied and frustrated members and aggravated providers. On the provider side, prior authorization is taking up to 74 minutes per request. That's a bunch of time that providers are typing in information instead of seeing patients and providing other clinical services. And it's leading to a great deal of frustration in the provider community as well. In 2027, it's expected that CMS will insist that all the payers provide an improved prior authorization process using electronic prior authorization. That gives us 2 years. In January 2026, those processes must be substantively in place as you prepare for deployment and go live in January 2027. Given the tight timelines, that means that today is really when you should be thinking about getting engaged with the PA process, and certainly in the near future. The approach, of course, is that you want to transform your prior authorization, not just check a compliance box. You want to get the maximum value of the tooling that you use to improve your clinical reasoning services, to improve your use of information, to create a high quality data tier, and then to be able to use that for things like training AIs or engaging in research or other functions. You want to really reduce friction and boost collaboration between yourselves and your providers, and really sort of have all of these multiple flows merge into benefits for both patients, providers, yourselves, and then, like I said before, additional use cases. One of the core elements of the prior authorization transformation is coverage requirements discovery. This allows payers to expose the contents necessary for successful submission to the providers at the time that they're filling it out. It basically enables the providers to know what forms and what information they must fill in at the time that they're filling in, and allows for more accurate decisions. It allows for reduced backwards and forwards. It's greater transparency. It improves the member experience. The whole flow is the provider makes a request for coverage. The payer returns a list of forms they have to fill out, or maybe even a decision that they don't have to fill out any forms. The provider then fills out those forms, goes through an assessment process, and then if the assessment process suggests that all the forms are completed properly, submission for adjudication happens. This flow is automated and is facilitated through CQL and other tooling. It really increases the effectiveness across the board of the prior authorization experience. So what are involved in intelligent prior authorization workflows? So first of all, you can use AI to improve the data flows, the quality, and the mappings between source systems and destination systems to understand the policies and the processes. AI is great at addressing ambiguities and doing rule mapping and can provide a role in predicting approval outcomes. However, AI on its own has some other challenges that you have to be aware of: accuracy, consistency, provability, and a few other aspects of the AI flow that perhaps lead to some ambiguity in why decisions were made. This means that there are other mechanisms, rule-based mechanisms, that can be used to provide greater certainty in conjunction with AI. And so there's a mix here that you should be paying attention to. Smile certainly has those in our toolkit. And the results, of course, are accelerated decision-making, as we've been sort of saying all along, improved clarity and policy responsiveness, and improved data quality in many use cases. And by improved data quality, what's happening is, as the information is coming in order to be able to do automation, you have to assure that you uplift your information so that it fits into the evaluative capabilities of your tooling. Even with AI, ambiguous data is a problem. So you have to have clean and well-structured information, and the tooling you acquire has to be able to help you with that process. And so what we're already seeing as a consequence of our engagement is that 40% of PA requests don't even need authorization. As I was saying earlier, during the CRD process, you can discover whether or not you need prior auth, and if you don't, you can move on. That's a huge uplift for everybody. The providers are seeing a substantive reduction in administrative burden, up to 70%, which is making their workflow much better. And payers are seeing reduced backlog, faster turnaround, and member satisfaction. So the upshot of prior authorization done electronically is that the burden is decreased and satisfaction improves, and the overall workflow is much more effective and efficient. So, better prior authorization for all. What does it do? It enables providers to reclaim time for care. It enables payers to reduce the cost of friction, and members for faster, clearer decisions. Smile Digital Health is very proud to present a whole suite of products that improve data, participate in prior authorization, and subsequently engage in clinical reasoning and the use of that information for additional functions. If you have any questions, please reach out to us and we'll be happy to talk to you. Thank you very much for your time.